Hello, this is Marianne Pedraza from the University of Arizona Global Campus. This presentation describes the logic model for the two top community needs in Hercules, California. Community assessments for Hercules, California determined that the two top priority health concerns are 1. Behavioral health challenges including substance use and suicide risk among the adolescents and young adults, defined as 10 years of age to 29 years of age, which represent about 23% of the population, or approximately 6,000 individuals. And 2, limited healthcare access that is culturally and responsibly linguistically appropriate for racial and ethnic minority adult populations, which is about 50% of the population, or 13,000 individuals. These issues were prioritized due to their widespread public health impact and contribution to health. An overview of the logic model presented here is a visual outline of how the program is expected to achieve goals. This is a high-level framework for evaluating effectiveness and continuous improvement efforts. The model begins with inputs, as shown on the left-hand side. The inputs include program infrastructure needs for operations that support the activities for prevention and treatment. The activities from the inputs are the program actions, which are implementation tasks necessary to educate, treat, and reduce risk factors. The outputs are data collected from the implementation program, which are key indicators for evaluation. The outputs lead to short-term outcomes, which are the immediate effects after participation engagement. Short-term outcomes then lead to intermediate outcomes. Intermediate outcomes occur after continued engagement, which can represent participation behavior changes, policy or initiative changes after evaluation of the program's progress. Long-term outcomes represent the impacts of the program at a population level after a sustained amount of time. This reflects the overall goal of the program. This logic model describes both behavioral health and healthcare access needs, as the two are interconnected with behavior change. The logic model begins with the inputs at the left-hand side of the screen of the program's community essential resources needed for implementation, such as program staff, stakeholders, local facilities, healthcare resources, and funding. The key activities, such as program development, cultural training, mental health and culturally tailored healthcare awareness campaigns, prevention programs, outreach workshops, and transportation services. These activities lead to measurable outputs. The outputs then lead to short, intermediate, and long-term outcomes, including increased participation, number of prevention and primary care visits, and expanded partnerships. The outputs will be evaluated to demonstrate the program's effectiveness when engaging the target populations. This logic model aligns and addresses both top community needs of Hercules, which are behavioral health and access barriers, simultaneously. The rationale for this approach is in the comprehensive integration of prevention, access, and education into established settings, with adding transportation, cultural responsiveness, and modality services. This model is expected to positively impact underrepresented populations by improving service utilization and reducing disparities. A logic model is important for stakeholder engagement. It provides a detailed overview of the program's goals and actionable objectives. The logic model visualizes how components such as activities, resources, and data translate into outcomes, which also guides justification for funding, community partnership, and guides decision-making for program effectiveness and continuous improvement. This is especially valuable for engaging stakeholders within a presentation, and it demonstrates accountability, strategic planning, and ensures that the program is aligned with the goals and objectives for addressing health disparities for community-based intervention. Thank you. Please let me know if you have any questions, and I will be happy to discuss.